At the American Psychiatric Association annual meeting in Philadelphia, Dr. Sagar Parikh discussed commissioning a play to address the stigmas surrounding bipolar disorder.
Stigma determines not only how people feel, but how they behave, whether they take treatment, and so on. We asked our own patients, and they also agreed that it's a big issue. And we were aware, both from our own observations and from the literature, that what is very compelling is someone's individual story. We are often so moved by the story of how someone faces some sort of challenge and overcomes that. We had previously seen a number of theatrical productions, sometimes from Broadway, movies, other times plays, where mental illness is shown in various ways. And we were struck that maybe that way, something through theater or through film might also be a powerful way to tell a story. And we had the happy circumstance of knowing Victoria Maxwell, who was an established Canadian actress and who had occasionally done some work, in addition to her regular theatrical work, she had done some work around mental health issues. So we decided to approach her and explored with her the idea of her creating a play that depicted her story, her struggles with mental illness, and how she's coped with that. When we looked at the literature, we first identified that while stigma is a very common concern, it's even a concern in people that you think wouldn't have it, and that's mental health providers. So that's why we targeted mental health providers as well as individuals who have bipolar disorder and perhaps feel some shame around it for the intervention. We put on this intervention, a play, and we measured the outcome in terms of how it changed their attitudes on various measures of stigma. And we found quite a significant effect. The effect, if we were to talk about it in numerical terms, is similar to the kinds of effects that you see after 8 weeks of medication for depression or 8 weeks of psychotherapy for depression. So from a clinical perspective, the statistical changes we saw were quite meaningful. And from a practical perspective, what we found is that individuals who saw the play told us that it made them think again about some of the decisions they had made in terms of to take treatment or not to take treatment. And it also made them think again about how they were going to handle how they're treated at work or in their relationships when somebody said something that now they could identify much more clearly as a very stigmatizing comment. It's kind of like teaching somebody what is racism. They then recognize it and then say, I'm not going to the back of the bus anymore. There are definitely multiple audiences. We think that the general public is somewhat less of an audience because we know other organizations have national media campaigns to fight the stigma around mental illness. So we don't feel that we need to tackle everybody and everything. We think that healthcare providers, because as healthcare providers, we already are faced with a simple fact. If we want to refer a patient with bipolar disorder to another provider, we often meet with resistance. There are issues of complexity of treatment, that's for sure, but we suspect at a personal level that there are also issues around stigma. And so we think that barriers within our own profession, and this is psychology, psychiatry, social work, across the mental health spectrum of professions, we think that's a very important target audience. The second group, of course, are the individuals who have the bipolar disorder themselves. Now, many people who've had the disorder for many years may have had the good fortune to work it out for themselves. They've come to terms with the illness. They've learned how to deal with stigmatizing comments and so on. So we think particularly younger patients, individuals who haven't had enough life experiences or who have just been diagnosed, they may be particularly susceptible to stereotypes and shame around this diagnosis. And so for them, the impact would be particularly strong.